Hi everyone, welcome to my theatre. In this movie, we will be learning about the investigation that is done to know about the blood flow inside the retina. Well, this is in the series of movie of retinal investigations. We are done with knowing about the retinal layers, for which we learned about the optical coherence tomography. And now in this movie, we will be learning about the investigations which we can do to know about the blood vessels and the blood flow inside the retina. Well, the most important investigation that is done to know about the blood flow inside the retina is the fundus fluorescein angiography. What is it? Here we inject a dye into the antecubital vein, which goes into the heart and then the common carotid and then internal carotid and into the eyes, and then we see the blood that flows inside the eye. And we take a series of pictures. We take the central pictures as well as the peripheral pictures, and if there is any pathology, we can see in those pictures. Basically, in the normal eye, the blood which flows inside the retina doesn't move out because of the inner blood retinal barrier, and the blood which flows inside the choroid doesn't reach the retina because of the outer blood retinal barrier. But if there is any disturbance or if there is any pathology, then we will see that these barriers are disrupted and the pathologies can be detected. In this, the dye which we use is a fluorescent dye, which usually absorbs the blue light and emits the green light. And this dye is 80% protein bound. And in this fundus fluorescein angiography, we can see both the retina and the choroid, but the retina blood vessels are visible way better than the choroidal blood vessels. Another thing we have to know is when we inject the dye, it reaches the retina in 12 seconds and it reaches the choroid in 11 seconds, which means it reaches the retina a bit later than the choroid. So first we will see the choroidal filling and then the retinal filling. So this is the most important thing that we do in to visualize the blood supply inside the retina. So which dye is used? We use the fluorescent dye. Fluorescent dye, which is how much protein bound? Which is 80% protein bound. And it absorbs the blue light and emits the green light, and we see the entire retina till the periphery. Okay, and the blood is given in which vein? It is the antecubital vein where the blood is given, and it reaches the choroid in 11 seconds and retina in 12 seconds. Okay, so now how does the picture look when we do it? This is how it looks. Basically, here you can see that the picture is bright because the blood has already entered the choroid, and also the few blood vessels of the retina, and gradually we will see that the blood is entering into all the blood vessels of the retina, and then finally it also enters into the veins in the venous filling phase, and then the blood moves out. But here we have an observation, and what is that observation? It's the fact that the central part, the macula, is black. Now you will ask why? If you remember, I have told you that the macula has a zone known as the foveal avascular zone, and in that foveal avascular zone it doesn't have a blood supply, and of course when it doesn't have a blood supply, how will we see the macula? Now you will say that why do we not see the underlying choroid? We can see the underlying choroid, but no, the underlying choroid is also not visible because in the macular area the ganglion cell layer is very thick. And the second reason why it appears black is because the macula has more melanin. These are the two reasons why the macula appears black. When do we see an enlarged foveal avascular zone? That is seen in macular ischemia. So by measuring the diameter of the foveal avascular zone, we can also know about the macular ischemia. Okay, so the important thing to remember is that the macula appears dark, and that is because of two reasons. That is because of the melanin and because of the foveal avascular zone. And the second thing we need to know is that in macular ischemia, the FAZ is more. Okay, these are the things we need to know in the FFA. Now, how do we appreciate the blood vessels of the choroid? Now that we understood how to know about the blood flow inside the retina, there is also a way to know about the blood flow inside the choroid, which is the indocyanin green angiography. In indocyanin green angiography, we use indocyanin green dye instead of the fluorescent dye, and this indocyanin dye is 95% protein bound, and again it goes into the choroid the same way, and the blood flows and we capture the images and we see the pathologies. So basically, in choroidal neovascular membrane or any sort of choroidal vasculopathy can be appreciated with this method very well. But both fundus fluorescent angiography and indocyanin green angiography are invasive techniques. So the modern era technique is the OCT angiography. Why? Because it's a non-invasive technique. So the question is, how do we see the blood flow inside the retina in OCT angiography? It uses backscattering of light. With the phenomenon of backscattering of light, we are able to see the dynamic blood flow in OCT angiography. Even though it's non-invasive, but the disadvantage is that we can't capture the periphery of the retina. It only tells us about the central. It tells us about both retina as well as the choroid, but it tells us only about the central retina. We can't know anything about the peripheral retina with this technique. Okay, so these are the three ways by which we know about the blood flow inside the retina and the choroid. So now let us know about few differences between them. Well, we have already discussed everything, but let's just revise. Okay, so the fundus fluorescent dye uses which angiography uses which dye? It uses the fluorescent dye. Indocyanin green angiography uses which dye? It uses indocyanin green dye. And OCT angiography doesn't use any dye. Now the fundus fluorescent angiography, which dye we see, the property of the dye is that it is 80% protein bound, and this dye is 95% protein bound, and this absorbs the blue light. It absorbs the blue light and emits the green light, and here it absorbs 810 nanometer light and emits 840 nanometer light, whereas here it uses the phenomenon of backscattering of light. Backscattering of light. This, for fluorescent angiography, we can see mainly the retinal layers. With indocyanin, we can mainly appreciate the choroidal blood vessels, but in OCT angiography, we can see both the retina and the choroid. But the fundus fluorescent angiography can help us to see the entire fundus. The indocyanin green angiography can also help us to see the entire fundus, but the OCT angiography helps us to see only the central retina. And as it is known to us very well that these two techniques are invasive, which makes them cumbersome, whereas the OCT angiography is non-invasive. So basically, is non-invasive. Okay? Clear to you? Uses fluorescent dye, uses indocyanin green dye, 80% protein bound, 95% protein bound, absorbs blue, emits green, absorbs 810, emits 840, and this uses backscattering of light. It helps us to see the retinal layers, the choroid, it helps us to see both. With this we can see the entire fundus, with this also the entire, but here we can see only the central part. These two are invasive, but this is non-invasive. Basically the OCT angiography helps us to capture the follow-up photographs when there is any diabetic retinopathy or other things. When the patient is coming for follow-up, it's a very good technique to appreciate the progression of the disease as it is non-invasive. Okay, now we have another technique which is close to this fluorescent, so I thought I should discuss it here. That is the technique of autofluorescence. Well, this is not to see the blood vessels, but I am discussing it here because it also uses the technique of fluorescence. What is autofluorescence? Autofluorescence means we have the retina has lipofuscin, we have the retinal pigment epithelium, and that retinal pigment epithelium has lipofuscin, and this lipofuscin absorbs the light and gives this autofluorescence. So basically the autofluorescence is because of the lipofuscin present in the retinal pigment epithelium. So because of this autofluorescence, we see the entire retina has a bright structure, but here the optic nerve is dark. Why? Because it doesn't have retinal pigment epithelium. We know that it doesn't have retinal, the optic nerve is just the nerve fibers, optic nerve head is just the nerve fibers, it doesn't have retinal pigment epithelium, so it is dark. Now the macula is also appearing dark. Why? Because the macula has more amount of melanin. And of course the blood vessels do not have retinal pigment epithelium, so they will appear dark. And now if there is any pathology which has increased amount of lipofuscin, then it will take the stain like optic disc drusen. Okay, so this is all about the autofluorescence. So what is the main molecule in this? It is the lipofuscin. It is the lipofuscin which is present in the retinal pigment epithelium. This absorbs the light. And optic disc, dark. Why does it appear dark? Because it has no retinal pigment epithelium. Why does the macula appear dark? Because it has no, again the macula doesn't have, because the macula has more melanin. And the blood vessels, because they don't have the retinal pigment epithelium, blood vessels means it's a different structure. And now this helps us to appreciate mainly the optic disc drusen. See, this is the drusen. Here the optic disc appears dark, but when it has drusen, drusen is basically made up of lipofuscin, and since it is made up of lipofuscin, we can see that in optic disc drusen, with autofluorescence we can appreciate it very nicely. So this is the investigation of choice for optic disc drusen. Fine. So this is all about the technique of fluorescence and also the way to know about the blood supply inside the retina and the choroid. I hope I could explain it to you in the best possible way. In the next movie, we will be learning about the third investigation, and that is the electrical activity of the retina. Do like, share and subscribe and encourage me. We will catch up soon. Thank you.